The bones of the skull consist of the one frontal, two parietals, and posteriorly the one occipital bone, and laterally two temporals here and here, and they contribute to the cranial vault or brain case. The sutures between these bones are the coronal suture, the sagittal suture, and the lambdoid suture. Between temporal and parietal, we have the squamous suture. Here we have the maxilla, left and right maxilla, which articulates with the frontal bone and also runs all the way down here to form the alveoli, the tooth sockets. Articulating with the maxilla anteriorly are the two little nasal bones, and posteriorly in the orbit is the lacrimal, which has the distinctive tear duct running through it. Articulating with the maxilla laterally is the zygomatic bone, which articulates with the frontal bone, as well as with the temporal bone. And forming the medial wall of the orbit, much of it is the ethmoid bone, and then posteriorly the sphenoid bone. The palatine bone also contributes a very small bit to the medial wall of the orbit. Here we have the one mandible. Looking inside the oral cavity, the roof is formed mostly by the maxilla, but also partly by the two palatine bones. The occipital bone continues all the way to here, forming the foramen magnum through which the spinal cord passes. Here we see the occipital condyles for articulation with the superior articular surfaces of the atlas. And anteriorly, the occipital articulates with the sphenoid bone. The sphenoid has several sets of wings. The pterygoid processes here, which means wing-shaped. And it also has lesser wings, and out here, greater wings that articulate with the frontal, parietal, and temporal, as well as the zygomatic. The temporal has a depression here, forming the ear canal, the external auditory meatus, or external acoustic meatus. The temporal also has this large bony protuberance, larger in males, known as the mastoid process, which contains mastoid air cells, sinuses, and it has the pointy styloid process, pointy like a stylus. The temporal bone also has a depression here for articulation with the mandible to form the temporomandibular joint, or TMJ for short, known as the mandibular fossa. And this long, thin, bony process that articulates with the zygomatic is known as the zygomatic process, whereas the process on the zygomatic that articulates with the temporal is known as the temporal process. Likewise, the part of the zygomatic that articulates with the frontal is known as the frontal process. The maxilla, where it articulates with the frontal, is also known as the frontal process. The frontal bone has prominent superciliary arches, which are more prominent in males than in females. This craniometric point in between them is called glabella. The craniometric point here at the intersection of coronal and sagittal sutures is bregma. The very top of the skull is vertex, and the craniometric point at the intersection of the lambdoid and sagittal sutures is lambda. which is the Greek letter L. Here we have the external occipital protuberance, which is more prominent in males, and it lies in the middle of the superior nuchal line, a site for muscle attachment.